low resource settings.
Hello, thank you for waiting for me to speak. I don't work in a lab, so this will be a shift from the prior presentations, but you'll also note that my slides are not as beautiful as the ones you've just seen. I'm a PowerPoint amateur at best, so I'm delighted to talk to you today about some work that is ongoing in Maputo, Mozambique. So Maputo is the urban capital of the country of Mozambique, which is a fairly large city of about 1 million people. The prevalence in Maputo, so Maputo is down at the bottom. I don't know if I have a little, do I have a little? Is that what this is? So it's way down here. It's a little bit like California, and Maputo is a little bit like San Diego. So it's really far away from the rest of the country. But the national prevalence is probably about 9 or 10%, but the prevalence in the capital is quite high. It's about 20%. A national survey showed that higher infection rates are correlated with young and sexually active Mozambicans, as well as those with higher educational levels, and of course, higher numbers of sexual partners. We actually sought to better sort of characterize, with that being known, what the risks might be for higher education students at universities. So we actually worked with the largest and oldest university in Mozambique, which is Eduardo Mondlane University, which is in Maputo. The total enrollment at this school is about 26,000 students. So to address our gap in knowledge about what higher education students are doing and what their risks for HIV transmission and infection are, we conducted a cross-sectional survey. This was delivered between July and November of 2017. It was a 75-item survey instrument that was focused on a lot of things, including sexual behavior, history of HIV testing, engagement with HIV testing services, and HIV knowledge in general. We recruited student participants throughout all of UAM's colleges. So they actually have 17 faculties that are distributed across Maputo, and actually 4 campuses that are outside of Maputo. So faculties are kind of like schools, right? So there's a school of education, there's the school of law, there's a school of economics. So we included every faculty that was represented at the school, including the 4 that were outside, and those are starred on this list. If you can see, there's a few, which the total number of students in those faculties is actually quite small. So we enrolled at each college in a manner so that the total enrollment at those faculties was proportional to the college size. And of course, our sample size is only about 500, although that's quite a lot of students to speak with and survey. But of course, you can understand that as a fraction of 26,000 students, it wasn't powered for statistical significance a priori. So here's just a summary of our participants. So our sample size is 500. You can see we are not quite there yet. So we have 30 surveys that are pending from outside of Maputo, which we are really trying to get, and I couldn't get them done for today. So we are waiting for those to come in. But of the 470, you can see that we have about 50% males, which is by design. So we proportionally surveyed both men and women at all faculties. So we did quite well in terms of hitting our survey targets, our enrollment targets. A vast majority of our participants are unmarried, 93% were single. Average age was about 22.7 years. 86% of us students that we surveyed were sexually active, and the mean age of sexual debut was 16.9 years. Within the past 6 months, they averaged about 1.5 different sexual partners. The majority of our participants come actually from Maputo district, so about 2/3 are from Maputo district, and you can see there's 1, 2, 3, 4 other districts that are sort of the next highest set of homes for our students. They come from all over the country. What else was I going to tell you? Sorry. Nearly 85% of our students are sexually active, and you can see that that number is actually quite high, quite a bit higher among the males than the females. The majority of participants, as you can see here, identify as some denomination of Christian. So that was a little bit of a tricky question because people kind of actually free texted their church's name, so we got a lot of Baptists and, Protestant. And so we had to sort of clump all those together, but about 3/4 identify as some denomination of Christian. And you can see that the vast majority are heterosexual, men who are sexually active with women who are sexually active with men. We did identify about 4% of our students, so MSM were a total of 11, and then there were 2 participants who reported sexual encounters with both men and women, and both of those participants were women. So this is a little bit of a summary in terms of HIV testing behavior. So nearly 80% of students had received an HIV test in their lifetimes, though many of them had not received a test in the past 12 months. Approximately a third of our students consider themselves at elevated risk. So it was a fairly simple question. Do you consider yourself at an elevated risk of contracting HIV? And about a third of the students said, yes, I do. So we sort of asked them why, and I'll get into that in another slide. But among those who did say, yes, I consider myself to be at an elevated risk, very few of them had actually tested for HIV in the past 3 months, and a very small percentage of them actually have never tested. So it was a kind of an interesting disconnection there. Here's some further numbers about sexual behavior specifically. So condom use is fairly common. So the question was, did you use a condom at your last sexual encounter? And 3/4 did say that they used a condom at their last intercourse. They report a number of behaviors that we also associated with elevated HIV risk. So a third of our participants report multiple sexual partners within the past 6 months. 10% of our students utilize commercial sex workers. 4% of them report injection drug use, and 11% say that they regularly engage in sexual behavior while intoxicated with drugs and alcohol. So this is kind of interesting data that at a population level is a little bit harder to capture. If you compare this with the population surveys of Mozambique, MSMs are probably about 2%, and injection drug use is actually quite low, difficult to identify too. So these are, I think, key populations that we kind of did not necessarily expect to find at the university level, but of course we know that they're there. So as part of our instrument, participants completed an 18-question knowledge scales, the KQ18 knowledge scale. So the scores there are out of a total number of 18 possible. You can see the average score is quite high, 12.7. We compared, however, just the scores between a couple of different groups and found that there was some statistically significant differences, specifically between the sexually active students and the ones who were not sexually active. And interestingly, those students that used condoms and didn't use condoms, there didn't seem to be much of a difference in terms of that scale per se. Oh, and I wanted to also mention there were a few questions that people sort of consistently got wrong. So there was, I think there's a lot of sort of misinformation, or there's sort of ideas that are not correct about HIV. So for example, there's a vaccine that can stop HIV transmission. Almost half of our participants thought there was a vaccine. About half of our participants thought that the withdrawal method was an effective way of preventing HIV transmission. And almost half of our participants thought that a woman couldn't transmit HIV if she was menstruating when she had intercourse. So those are probably important places to clarify information among this population. We also found some kind of interesting differences in sexual behavior by gender. So age of sexual debut is significantly higher among female students, so an average of 16.7 years for first sexual encounter for men and 17.3 for women. We also found, interestingly, that men were more frequently utilizing condoms at their last sexual encounter than women were. So 78% of men said yes, they did use a condom during last intercourse, and only 66% said they did for women. Again, the number of sexual partners is also significantly different, with men reporting almost 2 sexual partners in 6 months and women reporting about 1. Interestingly, there was really no difference with regard to that measured HIV knowledge score. So these are preliminary results pending 30 more surveys, but we do have pretty good data so far. Interestingly, lifetime testing rates are fairly high, higher than the national average. People estimate in Mozambique throughout the population, probably about 50% of people have ever tested. So clearly these students are more likely to test, but the vast majority have only tested within the past 3 months. And what I thought was very interesting was the differences between gender with regard to sexual activity. Women defer the onset of sexual activity, men have a higher number of sexual partners, and women tend to have lower condom utilization. And last point, which we all sort of know, is that scoring well on a knowledge scale is great. It doesn't necessarily give you a lot of information about what people are actually doing and how that knowledge may inform their sexual behavior with regard to risky practices. So last, we found actually quite interesting HIV transmission risk behaviors that I didn't necessarily think that anyone's spoken about specifically with higher education students. We know that they're young, we know they're sexually active, we know they have multiple sexual partners. We also know they have inconsistent condom use. What was sort of interesting to me, and I think important to disseminate, is that we do have key populations among these higher educational students. We have a small percentage of MSMs, we have a small percentage of people who inject drugs, we have people who utilize sex workers. We know that there's, as with university students here, there's a substance abuse, people having intercourse while they're intoxicated, and we also know in this specific population, people are not getting HIV tested very frequently, probably not as frequently as they should, given the risk factors that they're presented with. So 30 more surveys are pending. Hopefully we will complete those in the next month or so. After that, our goal is to do some qualitative interviews to sort of flesh out the findings that we found here, to talk specifically about key populations, to discuss things that may affect condom utilization. We saw that disparity in gender, whether it's negotiation, gender roles, transactional sex, and whether or not anticipated stigma is impacting whether or not people are engaging with HIV testing. I am very pleased to say that within the past 3 months, we've actually, the student clinic at UEM has actually started offering HIV testing, which surprisingly, up until now, they have not been doing. So that is a really nice addition to the sort of accessibility of services that these students can engage with. But we would like to use our data and our qualitative data to help us design an educational curriculum and a testing outreach initiative that is really tailored for this community. And that's all. And thank you so much.
Do you intend on testing any interventions within this group, and do you have any idea whether they might be more receptive to interventions compared to, for example, when we talked about the fishermen populations in Uganda?
I think it would be interesting to consider what interventions they would be open to, and that's something I'd like to explore with the qualitative data. I think, for example, there's so much stigma in much of sub-Saharan Africa just about HIV testing in general. We like to embed the option of HIV testing in health fairs, right? So people don't like to talk about, like, we're doing an HIV testing fair. It's like, let's test you for lots of things, and HIV is part of the health package. That seems to be an approach that's well received. This is, however, kind of a unique population compared to Rakai, for example, where, these are fairly educated kids. And so we potentially could just talk about HIV and see, but I think that's a question that needs to be fleshed out. I don't think anybody's really considered it specifically for higher education.
I have a question. What is the estimated HIV and STI prevalence among university students? Is that known?
It's not, and I think that's something that we'd like to measure. I don't think that anyone has actually done that work specifically for university students. There's some, obviously the HIV prevalence is known for the population of Maputo, but I think specifically because they are a unique and a high-risk population, I think it would be something that'd be very interesting to do at the clinic. And I know when I was writing this proposal, we worked with the clinic, they told me 70 students per month present for STI testing or with STI symptoms. So it's a significant number. I just don't think that anyone is doing that sort of epidemiological work. I think you were here first.
For the students that had misconceptions, it seemed like 40% for every question. Are those the same 40% or?
That's something I have to do. I have to be a little bit fancier with my understanding of our results to get that understanding. But it seemed like it was such a consistent number, like, they were all like mid-40s, mid-40s, mid-40s. But in order to say, yes, they're all the same students that missed that question, I don't have that visibility yet. But it's a good question.
Very nice presentation. Do you think you should explore intergenerational or cross-generational relationships, especially among the women?
Yeah, that's a very good question, because I think that with transactional sex, or especially with women of that age, that's certainly an important factor. So it's something that I'm planning to ask about. We didn't specifically ask the women about whether they had older, like sugar daddy type experiences, but it was quite striking to me that that the condom use is quite low, and I have a feeling that it's part of this sort of like negotiation that happens potentially for transactional reasons. But that would be something I'd like to think more about.
Okay, one more question.
Hi, very interesting study. I just want to know if you have some analysis on like where the students are coming from, if they are from the city or if they are coming from other provinces.
There are, I think it was up here. So about 3/4 are from, they self-identified as being from Maputo, about 5% from the further away, from Zambezia, Sofala, and Gaza, and Hamambe. There's a very small amount that are actually not even from Mozambique, for example. There's a few that are from Tanzania. But the vast majority of our students are actually from Maputo.
And there in the demographic data, I think that you have some that is raising hospitality, is the people that are living in the house schools?
Yeah, that was one of the questions that we asked, was whether or not they lived on the student housing or not. And I have to look back at it because I don't remember exactly how people answered that. Okay. But we actually got a lot of data about where people resided, whether it was off campus or on campus, and which building they lived in. So I think we may have actually very detailed results about these potential clusters of behavior.
Okay. Thank you.
Thank you. Thank you, everyone.
Thank you very much.